So now we are going to go to labor and delivery. So this is a labor and delivery room. This is where the babies are born. When you first get in here, the lady from admitting will finish up your admission process in the room. So she will log on to the computer and take about 2 to 3 minutes to verify your registration information. And she will also take a photocopy of your picture ID, like a driver's license, and your insurance information. So after that, your nurse will come in, we'll introduce ourselves and give you one of our really cute designer gowns to change into. And you can bring your own if you prefer, but we'll spend about 20 minutes doing an initial assessment of where you're at in labor. So in order to do that, we'll ask you if we can put you on an external fetal monitor for about 20 minutes. And during that time, we'll monitor here in the room. We will monitor your baby's heart rate and your contractions, and it'll also read out at the nurse's station. So during that time, we will ask you some questions about your medical history and your pregnancy, but our main focus will be, what are your plans for labor and birth? What's important to you, and how can we best help accommodate your requests? So we'll just try to get everybody on the same page, and then we'll check your cervix, see how far you're dilated, and then you're going to have a pretty good idea of where you're at in labor, and you'll be able to call family support team, whoever you're planning to have with you here for the birth. So after that 20 minutes, we generally will take you off the monitor and have you get up and walk around, move around. We know labors are easier to cope with and generally go faster if you're able to be upright and change your position frequently. So I wanted to talk to you just briefly about some options that you have for labor. The bed does a lot of different things. We have a squatting bar that fits over the bed, and you can hang on to the top of the bar and be in a squatting position. You can use that for labor or for pushing. We can take off the squatting bar. We have a lumbar support for your lower back. You can sit the head of the bed all the way up. The bottom third is actually a separate mattress that we lower for the delivery of the baby's shoulders, or we can take the mattress off. Underneath there are footrests and stirrups, so we can use either of those if you would like. And we also have handles to hang on to for pushing. Other options you have here in the room is a rocking chair. Rocking sometimes is a great way to get into a rhythm with your breathing. We also have a birth ball. They're just big physical therapy balls, but you can use them 100 different ways in labor. So use your nurse as a resource. In the moment, we can make some suggestions about positions for comfort. We also have a straight back chair that you can use in a variety of ways, even straddling the chair or using pillows to help with different labor positions. So here in the bathroom, we have a few options for labor that are comfort measures. In the tub is jets, so you can sit in the tub. We also have a shower where we can take the nozzle off the wall and direct the flow of water, let's say on your lower back if you're having back labor. And we never run out of hot water, so you can just use it all day or all night long. Dad or support person can sit behind mom and help hold the water on her back if that sounds good to her. I've had a lot of women spend their whole labor in the shower, and it's comfortable to them. So remember, don't rule that out as an option to try for labor. We have plenty of towels and washcloths available, as well as extra gowns if you need them. So if you are deciding about medication during labor, I wanted to tell you some options. We do have some medication that can be given through the IV, and it takes the edge off of the contractions. And we try not to give it too late in labor so that the baby does not have the effects of the medication when the baby is born. We also have an epidural option for you. We have 24-hour-a-day anesthesiology here in the hospital, as well as 24-hour-a-day obstetrician here. So they are available whenever you decide you would like to have your epidural. So once you decide on that, they will come to your room. If you do not already have an IV started, you will need an IV. And once the anesthesiologist comes in and asks some questions, it'll take about a half an hour before you're comfortable. And you will be in bed, won't be able to get up and move around, but we'll continue to change and move you side to side so you're not staying in the same position for a long time. You will have a little button that you'll be able to push to control the level of the anesthesia. And we wait until after the baby and the placenta is delivered before we turn the epidural off, and it takes about 45 minutes to an hour to wear off. So you will be able to get up and empty your bladder and take a shower after the delivery. When the baby's ready to be born, your nurse will call for another nurse to come in. She'll stay in the background of the room, do the charting on the computer, so your nurse can be right here at the bedside. Your doctor or midwife will be at the foot of the bed, and your support team will be able to be on the other side. Typically when the baby's born, they'll bring the baby just right up onto your tummy and we'll dry the baby off. They come out, they're all wet. They don't have any clothes on. It's about 70 degrees in here, so they can drop their heat quickly. One of the best ways to keep their temp stable is to keep them skin to skin with mom after the delivery. So that's what we plan to do for the first hour after they're born. We also know that babies learn to nurse better if they learn in that first hour. Their sense of smell is the strongest it'll ever be in those first few hours of life. And that helps them to orient themselves and to find their new source of nutrition after they've been born. When they come out, they look pretty dark, purple, and then when they take a couple big, deep breaths, their lungs expand for the first time, and that creates a negative pressure that keeps their lungs open, and then that seals off a little hole between the right and left side of the baby's heart. So when you see your baby turn that beautiful pink color, you will know that all of that is working just fine. And we can watch for that to occur while the baby is still on your chest. As you hold your baby, we will be checking their temperature, their respirations, their heart rate, observing their color, but we can do all of those things while the baby stays with you. We will involve dad or the main support person in that whole first hour of bonding with your baby. So that's the reason we also ask that you don't have a lot of extra people in for the first hour after delivery. The babies are very alert and awake and oriented to your voices because they've been hearing your voices for the last 3 to 4 months. So if you talk to your baby and cuddle your baby and touch your baby, they will respond to you in that first hour and try to make eye contact with you as well. So we just try to keep you together as a new family unit and not separate baby from mom if at all possible. The skin to skin, there are so many reasons why that's important for babies. So if you want to know more, you can look it up on several websites that we have available, and you'll be able to see that on our website as well. When the baby is delivered, they will wait for the placenta or the afterbirth to be delivered, and that usually takes 5 to 10 minutes. And then if you had an epidural, we'll turn off the epidural. If dad or main support person would like to clamp and cut the cord, we'll be happy to allow you to do that. And we'll just keep the baby then with mom. For mom in that first hour, you're going to be pretty thirsty and hungry after the baby's born. So we keep hot and cold food for you back here, and we will bring you a big pitcher of ice water, whatever else sounds good to you. And if you need ibuprofen or something stronger, you deserve it after having a baby. So we will just love to pamper you a little bit. Our job is to mother the mother so she can mother her baby. So just let us take care of you for a while in that way. And then when you're ready, we'll help you get up and you can empty your bladder and take a shower and be ready to move then to the other side of the 5th floor to the mother-baby unit. For the baby in the second hour, when you're ready, we'll bring in a scale here into the room that will weigh and measure the baby on. We'll do their footprints and their bath. We will also put an ID band on the baby that matches mom and her main support person. We will put a halo button around the baby's calf and it's covered up with a little white sock, and that's our security system. So all of that will take place back here, as well as we'll give the baby 2 medications whenever you prefer that to happen. Vitamin K shot in their thigh that helps with blood clotting, and erythromycin ointment in their eyes. So we will do those back here. We will also offer you the opportunity to have the hepatitis B vaccine. We know that it can help quite a bit more if it's given within the first 12 hours after the baby's delivered. So that will be an option that will be available to you as well. When you're ready to move, we'll bring in the wheelchair and give you your sweet little baby in your arms, and we'll load up all your things on a cart, and we'll go down a back hallway so you won't go out where the security guard and all the visitors are waiting, and we'll take you to the mother-baby unit. So typically you're back here about 2 hours after the birth of your baby.